Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video in response to a question that someone posted on one of my videos. They were asking about basically saying that they started developing some issues with their eustachian tubes after taking an antiparasitic called Artemisinin. Artemisinin is derived from the herb wormwood, and it has different effects against microbes. It's best known for its antiparasitic effects. On that note, it can be useful in the treatment of the co-infection of Lyme disease called Babesia. And And then in clinical practice, it seems to have some effects against, say, the Lyme bacteria itself and other infections as well. Also has anti-cancer cell properties, and it's really an amazing compound, really. So essentially the person had posted a question saying, I started taking artemisinin. I developed issues with my eustachian tubes, which is a structure that connects essentially the ear to the sinuses, and ultimately, I was wondering, what's going on with that. So I of course said something like, "Well, I can't give you any medical advice because I can't, because you're not my patient." But what I said is that sometimes I have seen patients develop issues with their lymphatic systems after they take certain systemic antimicrobial agents, and the lymphatic system is really fascinating. I describe the lymphatic system to my patients as being kind of like it's a fluid recycling system in the body, and it's also the waste removal system in the body. So we think about our livers and our kidneys and our bowels and our sweat glands as being these main detoxification organs, and they certainly are. The lymphatic system is kind of an unsung hero. A lot of folks who are in the dealing with chronic illnesses and things like that have very likely come across the lymphatic system as being something worth talking about, something that's important. A lot of folks just in the general public are not really aware of their lymphatic system, to my understanding at least. A lot of people are like, what's the lymphatic system, when I bring it up in practice. But the lymphatic system is really important because it ultimately takes the waste products, the garbage essentially from the cells, and toxins from the cells, and transports that into the circulatory system. And then from the circulatory system, the liver can metabolize those toxins and process them, or the kidneys can flush things out into the world through the urine. But so the lymphatic system is really an important mediator. And if the lymphatic system starts to get congested, if it starts to get kind of backlogged, then patients can start noticing that they might feel more congested, or their ears are getting plugged, or they might notice that they have more eye symptoms like watery eyes or itchy eyes or irritated eyes. They might get more brain fog. Sometimes people will get what I refer to as lymphatic pain. They'll start noticing pain in regions where they have lots of lymph nodes, like around their necks or their upper chest, like around their collarbones, either above or below, sometimes under their armpits, sometimes in the groin area. And so when I'm recommending systemic antimicrobials to a patient and they start developing some lymphatic system related symptoms, then I'm thinking to myself, well, it looks like we are either killing things off or clearing things out faster than the body can deal with it, and so the lymph is getting backlogged. And so it means, well, we may want to start backing off on the potency or the intensity of that antimicrobial treatment, because it sounds like the body's not handling it optimally. So we want to back off. We want to work with the body, not overburden it inadvertently. And then it also suggests to me that maybe we need to work with some things to help support the lymphatic system. There are great herbs that can be helpful to move the lymphatic system. There's something called drainage therapy that can sometimes be helpful to help move the lymphatic system. One of the tools that I really like to use with my patients is something called targeted dry skin brushing. Targeted dry skin brushing is notably different than traditional dry skin brushing. So if you're listening to this thinking like, oh, dry skin brushing, I know all about that. I do that myself. Targeted dry skin brushing is quite a bit different. There's a website put out by a chiropractor. It's called Stop Chasing Pain, and he teaches or goes over this very specific way of doing dry skin brushing. It's very targeted, and it's just night and day in terms of the difference, in terms of the potency of how well it can work. Traditional dry skin brushing is wonderful and lovely, and I've recommended it many times. I exclusively recommend targeted dry skin brushing now if I really want to get that lymph moving well. So doing that is helping to basically manually move the lymph. So in a nutshell, just in regard, circling back to the question that was posted with respect, or on one of my videos, it's something where if there are lymphatic related symptoms that come on after working with a systemic antimicrobial, regardless of what it might be, I'm thinking to myself, well, do we need to start working on supporting the lymphatic system more directly? What are the things that might be standing in the way there? And then also being thoughtful about or mindful of the fact, or questioning, should we potentially back off on the intensity of this treatment? So I hope that information was helpful. If anybody has any questions about this or any of the other many topics that I enjoy talking about that I've posted on, or other topics, feel free to comment in the comment section below, and I'm happy to put together other videos to talk about whatever people are interested in.